Joint replacement and repair is your opportunity. It's an opportunity to look at this as a step forward rather than a step backward. Have you ever wondered what it would be like to eat in a way that aligns with your goals for health, well-being, self-care? Do you have goals in these areas? If not, it's time to kickstart your health and get nutritionally fit before surgery. So being nutritionally fit going into surgery of any kind can help improve the quality and the rate of your recovery. It can also reduce your risk of infection and rehospitalization. What does it mean to be nutritionally fit for surgery? Well, it's you working on being better, being healthier, a healthier body weight, healthier blood sugar, more balanced blood sugar, and being nutritionally full instead of insufficient. Hi, I'm Tara, your ortho nutrition dietitian. I'm here to tell you that joint replacement and repair is a great time to work on achieving a healthy body weight. If you are overweight, just a small amount of weight loss can make a big difference on all of your joints. Did you know that 10 pounds of extra weight can add 40 pounds of pressure to your knees and your lower body? That weight simply wears down the joints before their time. Not only that, it can cause inflammation to tissue, which causes damage to all tissues over time. Losing that small amount of weight and keeping it off helps to reduce your risk of arthritis. There are also a whole host of other benefits to losing just 5 to 10% of your total body weight. Losing that 5 to 10% can improve your cardiovascular health by helping lower your blood pressure, your cholesterol, and reduce your risk of heart disease. It can also help with your metabolic health, improving your insulin sensitivity and your body's ability to balance its blood sugar, your respiratory health by opening the airway and may help reduce sleep apnea symptoms. It can improve your energy and use of your energy during physical activity by delaying fatigue, and your mental well-being, just increasing your overall confidence and your perception of your own body. How should you eat to achieve a healthy body weight? So start simply. Picture a plate and make half of that plate a colorful variety of vegetables. Different textures, but different flavors, different freshness, cooked, raw, whatever. Just make half that plate vegetables. Those are your protectors and your preventers. They have all sorts of nutrients your body needs. Make a quarter of your plate coming from carbohydrate. Carbohydrates provide energy. They provide gas in your tank to fuel your muscles and to fuel your brain. They're also the precursors to those happy hormones that make us feel good. So you need carbohydrate. The other quarter of your plate can come from protein. And protein is absolutely imperative, especially after surgery, because it helps to repair and build your immune system. Drizzle all of that with a little bit of healthy fat, a side of hydration, and a sweet top off with fruit. And that's your balanced eating plate. Do the best you can, do it 3 times a day, and you'll be on the right track. So let's take a closer look at the nutrients I just talked about on that plate. There are 3 macronutrients. We need to get all 3 from our food. I will introduce you to these 3. You probably already know what they are. Carbohydrates are the first one, and they're your source of energy for your muscles and your brain. Do you know what foods have carbohydrates? There's a variety of different ones illustrated in this photo. Grains, beans, fruit, starchy vegetables, pasta, flour, to name a few. Potatoes, peas, corn, rice, those are all forms of carbohydrates. Surgery is like recovering from a marathon. Your body needs carbohydrates to heal, repair, and put your body back together. Carbohydrates provide you energy for optimal function during and after surgery. Eating enough carbohydrates spares muscle breakdown and also improves your immune function. So what is enough? 3 to 4 servings of fruit per day, 5 to 8 servings of high fiber grains. And when I say high fiber grains, I mean 3 grams of fiber or more. The next macronutrient I'm going to talk about is protein. Protein is necessary to build and repair all the tissues of the body. Do you know what foods contain protein? Sources of animal proteins are beef, chicken, pork, poultry, seafood, fish, dairy, eggs, all contain protein. You want to get a variety in your diet because they all contain a variety of different amino acids that work to build and repair all the different tissues in your body, particularly bones, muscles, tendons, ligaments. Those are the ones really relevant to joints. Why is it important after surgery? Well, it's to build and repair those tissues. Protein also helps give your immune system a boost. After surgery, like I said, it's a marathon and you're at risk for different respiratory illnesses and infections. So you want to make sure you're getting enough protein, enough carbohydrate. How much protein is enough protein? Well, take a look at your palm. This is about 3 ounces. You want to have about this much protein 3 times a day. And then 1 to 2 ounces, about a quarter of your palm, as a snack between meals, once or twice a day. Fat is your third macronutrient, and fat is a source of stored energy for the body. It contains 9 calories per gram versus carbohydrate and protein, which contain 4 calories per gram. Why is fat an essential part of our daily nutrition? Healthy fats like fatty fish, olive oil, nuts, seeds, avocados provide the body with essential fatty acids that are important anti-inflammatories. Fat helps the body absorb the fat-soluble vitamins A, D, and E, and fat also gives the body energy, protects our organs, satiates our hunger longer, and when combined with carbohydrate and protein, provides that extra satiation distance. How much fat should you eat each day? Well, about 25 to 30% of your total calories should come from fat. And when you think about that plate, you think about adding fat for flavor. Adding flavor to the vegetables, adding flavor to the starch, and sort of drizzling that healthy fat throughout your plate. Then we also have naturally occurring fat in dairy, meat, cheese, nuts, seeds, and that helps you get to that 25 to 30% of your total calories without having to weigh and measure. What does that mean when we're talking about adding fat to our diet in the form of salad dressings or oil or butter or things like that? It's limiting it to about 5 to 9 teaspoons per day. The next big thing to think about when you're focusing on weight loss is high volume, low calorie foods. And what those are going to be are vegetables. Most vegetables are full of water and fiber and starch, and they help fill you up longer, take up more space in your stomach. That is one reason why 50% of your plate should come from vegetables. If you aren't used to doing this, if you're not used to vegetables being a main course on your plate, it's going to take some time, practice, and adjustment. Do you not like vegetables? What's not to like? They're colorful. You can cook them in a variety of different ways, flavored with healthy seasonings and fats. They're low calorie, high volume, and if you are not used to eating them often, like I said, it will take learning and practice and finding out how to cook them and what flavors to add to make them part of your daily routine. So we have more information about food, nutrition, and diet than ever before. It's accessible everywhere. There's tons of misinformation, there's correct information, there's what your neighbor did, yet we still struggle with weight. We still struggle to achieve that healthy body image and a weight that feels good for us. What gets in the way of losing that weight and maintaining healthy weight? It's not lack of information. Loss of motivation in the face of food triggers and nostalgia and things we had eaten as a kid that may not be so good for us now, lack of self-acceptance, starting where we are and just going from there, mindset like fear of failure or perfection or self-sabotaging ourselves because we are afraid we're not going to be successful at weight loss. And then there's just life, stress, fatigue, all these things get in the way of eating in a way that aligns with how we want to feel and what we want to accomplish. Here are a few strategies to adopt as you begin to modify what and how you eat. Number 1, accept progress over perfection. That means striving for a healthy way of eating, a balanced plate 70 to 80%, preferably 80% of the time you're eating each week. The other 20, 30%, just cut yourself some slack for being human. Number 2, identify your why. When motivation is gone, and motivation does not last, remember what you're after, like the ability to take walks in nature, play with your kids, participate in athletics, and do these things with energy, strength, and without pain. Number 3, identify fears and patterns around food by pausing before you eat something. And ask yourself, why am I eating this? Am I eating this to nourish, build, repair? Or am I eating it for pleasure? Am I eating it for community? Am I eating it for just the flavor of it? All the reasons are okay. It's just about identifying why you're eating it and paying attention to it. Number 4, making balanced eating routine by not skipping meals and nourishing your body instead of starving and depriving it. When we deprive ourselves, it just makes us want things more. These are just a few of the things aside from what to eat that we go over in our ortho nutrition class. Each week, the orthopedic department at Tahoe Forest offers a nutrition lunch hour. Are you interested in learning more about what you eat, why you eat, how you eat, and adopting new behaviors and routines? Well, you can join me every Wednesday for a complimentary class at Tahoe Forest Center for Health, hosted on Zoom, 11:30 to 12:30. You can register by calling the Tahoe Forest Center for Health.